Hi everyone, here's your data update for Phase 1B Week 6. As expected, we had a significant slowdown in the 7-day rolling average pace of doses administered due to shipping delays. But second doses are climbing back to pre-winter storm levels, and we have faith that first doses will improve with increased supply and on-time shipping. For data reported through 2/24, all categories of providers saw a dip in administration due to shipping delays. And we know you are still playing catch up, but despite all of this, let's celebrate some things. 1 in 7 Chicagoans 18 and over have now received a first dose of vaccine, and 1 in 3 Chicagoans 65 and over have received a first dose of vaccine. This is great improvement. As of vaccine and case data received by February 23rd, Chicago residents have received over 450,000 first and second doses of COVID-19 vaccine. 21% were given to Chicago residents outside the city, but 36% were given to non-Chicago residents at Chicago sites. We know that some of this is unavoidable with essential workers who work in Chicago, but outside of those patient groups, please make sure that you are trying your best to use Chicago vaccine on Chicagoans. Apart from the weather, we remain at the perfect time to vaccinate, with the cumulative vaccination numbers, the yellow bars, continuing to coincide with low community cases, the blue bars, and therefore low COVID transmission. As of the week prior to 2/24, exactly 50% of Chicagoans vaccinated that week were Black or Latinx. There appear to be continued improvements in the percentage of Latinx Chicagoans vaccinated last week, nearing the proportion of the city's overall Latinx population, as you can see in the upper right-hand corner. Unfortunately, it looks as if vaccination rates in Black Chicagoans are plateauing, and the percent of Black Chicagoans vaccinated last week still remains lower than the proportion of the city's population that is Black overall. The first dose equity gap remains, with cumulative coverage as of data reported through 2/24 at only 8% of Black Chicagoans and 8% of Latinx Chicagoans receiving a first dose, compared to 14% of white non-Latinx Chicagoans. This is why the city is trying to center vaccination opportunities in Protect Chicago Plus communities. And we appreciate the work of every vaccinator, but especially the providers who have chosen to go the extra mile to partner on events in these neighborhoods. On the left-hand side, you can see the hatch overlay dark blue community areas are Protect Chicago Plus. And on the right is where our mobile vaccination events have occurred to date. Because the initial wave went to long-term care facilities, we have work to do more events and allocate more vaccine to Protect Chicago Plus neighborhoods. But we're making progress. Of the sites in the right-hand map, the blue dots are long-term care facilities, the red circles indicate that the event occurred the week ending 2/20. The black dots are the mobile sites, 20 of which were CDPH-run events. The yellow circles indicate that the event occurred that week ending 2/20 as well. Provider report cards were piloted last week to FQHCS. All COVID-19 vaccine providers should expect report cards on how their inventory is being managed, how often they are reporting into Vaccine Finder, and the ages, residency, and demographics of the patients you are vaccinating in the coming weeks. We are also bringing on board a healthcare provider consultant dream team, who you can request to help troubleshoot any barriers you're finding to ramping up your capacity. So in summary, a lot of work ahead, with only 10% of seniors over the age of 65 having completed their full COVID vaccine series, and only 5% of those 18 and over having completed the series. In addition, the first dose racial equity gap is real and needs to be addressed head-on in our communities with trusted voices and partnerships with community-based organizations. The Protect Chicago Plus street teams are out knocking on doors every day, but nothing can replace a strong recommendation from a trusted healthcare provider. Keep up all your hard work, and we'll talk again next week.